I chose MUSC just because when I looked at the program, I thought it would work with my work life, my personal life, and then I also liked the fact that this program was a hybrid program. So I could, do some of my program online, but also come into the classroom and feel like a traditional student in a sense. And I really love it coming back here, and I get to enjoy Charleston a little bit and also interact with all of my professors that I'm just learning from online. So I really like that aspect as well. And I also like the fact of how many clinical hours that were required of the program. I wanted something that would give me enough experience to feel confident in being a great nurse practitioner upon graduation. Yeah, so I first decided to be a nurse when I was younger. My little cousin was born super young, and he was in the NICU, and the nurses weren't supposed to bring me back into the NICU, but they did. And that was my first exposure of being in a hospital setting and seeing nurses, and just seeing them work with him and care for him really inspired me to be a nurse. So I said for the longest I was going to be a baby nurse. Didn't turn out that way, but when I was in high school, I actually got admitted to the hospital for Stevens-Johnson syndrome, and seeing those nurses care for me and just kind of, encourage me and help me get back on my feet, it really inspired me to want to become a nurse as well. And I was like, one day I want to be like those nurses who care for me and, make a difference in other people's lives. So that's what inspired me. Being the first nurse in the family is kind of scary because everybody comes to you with questions and stuff like that. But it was great though too, because it was hard to find clinicals because I don't really know medical professionals like that, but the college did provide me with people who are willing to precept, and I thought it was really nice too that alumni actually gives back and tells the professors here that they're willing to precept, and they give us those options. So it was great that they offered that as well. So that's how I was able to find most of my clinical spots too. So that was very nice and helpful. Like I said, I like coming to campus. So when we come back for our OSCEs, I really enjoy sitting in the class, and they have different speakers come, and we get to learn about pharmacology, and then all the way to we just started having diversity and inclusion type classes, and I think that really helps to shape you overall as a nurse, because you need to know all of that kind of stuff. So I feel like they're teaching us not only leadership, but also the clinical portion, and I enjoyed that a lot. I think that's helping to shape me to be the nurse practitioner that we need